What is the minimum required treatment when it comes to high-level disinfection or sterilization for semi-critical devices?
Sterilization.
Minimum requirement,
Class,
not maximum requirement. The minimum
class
requirement.
two,
What?
two, classification number two.
No. She already did give you the class based on the Spalding classification is a semi-critical device. So that's what I wanted. So for semi-critical devices, there is a minimum requirement for sterilization or high-level disinfection. What is the minimum requirement for sterilization or high-level disinfection for semi-critical devices? How do we treat them when they're decontaminated and brought to prep and pack? How do we treat semi-critical devices? What is the minimum requirement for high temperature uh for disinfection or sterilization? What is the minimum requirement?
High level disinfectant.
What?
High level disinfectant.
Yes, high-level disinfection is the minimum requirement for semi-critical devices. You are now allowed to perform manual high-level disinfection in medical facilities.
True.
It's false. It's false.
Why is it true?
Because some instruments can only be cleaned manually.
Yes, when instruments are cleaned manually, now we move to the next step of either when instruments are already clean, now you have to determine whether this instrument is going to be disinfected or sterilized, right? Now with semi-critical instruments, some of them can be sterilized and some of them can be, but we're talking about the minimum requirement. And the minimum requirement for semi-critical item is high-level disinfection. According to your book, chapter 9, facilities should no longer do manual high-level disinfection anymore, unless you don't have an AER, which is an automated endoscopic reprocessor. So you are no longer allowed to perform manual high-level disinfection. You can perform manual low-level disinfection, not manual high-level disinfection. Do we understand this? Is it clear or is it confusing? So going forward, unless your hospital doesn't have any AER, which is the automated endoscopic reprocessor, then you can do high-level disinfection manually. But now it's required to only do high-level disinfection by automation. Anywhere you work nowadays, if someone brings down a GI scope, it should be high-level disinfected using an AER for any critical device. I mean, semi-critical device. Any semi-critical device in the United States of America should be processed using endoscopic automated reprocessor. If we don't have it, then we can do manual because they are moving away from manual processes of high-level scopes now. We shouldn't be doing that manually anymore. When we have a GI scope, it should be put into a machine now to be processed. We stop doing that, washing it, putting it and timing it with our clock on our hand. No more. The SGNA has said, and Amy has said that we should not do that. The only way you should be performing a manual high-level disinfection, keep in mind, not just disinfection, high-level disinfection, manually should not be performed unless you don't have an automated endoscopic reprocessor. If you walk into a hospital and you see homeboy soaking that semi-critical device in a rapid side for 15 minutes, your question should be, you guys don't have any AER? If he says no, that's allowed. If he says yes, that's not allowed. Because every scope now, every semi-critical device that requires high-level disinfection should only be disinfected using automated endoscopic reprocessor. No more manual. Please don't get it confused. I'm not saying all disinfection processes. I'm talking about semi-critical, high-level disinfection should only be done mechanically. And the only way you can find yourself doing it manually if you don't have a machine at your hospital, then you are allowed to do it manually. That was the last chapter we covered. So going forward,
Question.
please go ahead.
In regards to, let me say, state examination,
Yes.
let me say the question they ask high level disinfectant. Is it true or false? Can we do it manually or we cannot? So the answer should be no.
That
We
is an
can't,
incomplete.
right?
That is an incomplete question actually, because it should give you an option. Because you can do it. You still can do it. You are allowed to do it if you don't have. So the question should be complete, because the only way to perform high level disinfection now is by mechanical means, right? By the endoscopic processor. So a true or false question that will be true or false will be this way. One can perform a manual high level disinfection if they do not have an endoscopic reprocessor. That answer is true. You can do that if you don't have it. And your answer will be false, is that in a one can perform manual high level disinfection if he has an AER in his facility. That answer is false. You hear how the questions go? Is it confusing?
Yes.
Either way. You can perform a manual disinfection, manual high level disinfection, if you do not have an automated endoscopic reprocessor. You cannot perform a manual high level disinfection of a semi-critical device if you have an automated or endoscopic reprocessor in your facility. You shouldn't do it because it's only supposed to be automated. The only time you can do it without automation when you don't have any machine in place. So follow the
Is
question.
that a code violation? Could they get coded or anything like
Yes,
that?
they can get
After
written
the
up.
violation?
Because remember, how would they find out? It's documented, right? When you reprocess your AER, the endoscopic automated reprocessor, have printouts. They can go back and plug that thing into a computer. It gives them, if you lie on a paper saying that you did an automated reprocessing, because when you do your endoscopic reprocessing on those scopes, you record the serial number of the scope, you record the doctor who used the scope, you record the name of the patient the scope was used on, you record the date, you record their number, the catalog number of the rapid side, the high level disinfectant used. All of this information are traceable. Okay, if you lie and said if you got everything right, they want to know when you ordered that disinfectant. The catalog number will be with material management. They'll go back to material management and order that. Also remember, your disinfectant has an expiration date from the date it was opened, based on the use life, and your use life might be between 14 and 28 days. When these guys investigate, they are professionals. They know what to look for. So if you lie on the documentation and there's a hepatitis C outbreak from your hospital resulting from a high level disinfection or from flexible scope, you'll go back in time, step by step by step. I'm giving you this information so you don't put yourself into any quagmire by not following the instructions, or somebody's trying to speed up, like, oh man, I know we have the endoscopic reprocessor, but we need like 5 GI scopes. Like, now, can you manually do it? No. Your answer should be a clear no. You cannot get fired for that. And if you're fired, you call the labor law, you call FDA. I got fired for protecting a patient, because according to these standards, I should not be doing high level disinfection for semi-critical instruments manually. Treatment should not be rushed in this case. And if they are, they can send them to a visiting hospital, because even if you treat that patient, the patient come by with hospital-acquired infection of hepatitis C, you ruin that person's life. So, do we get that clear about high-level disinfection over here? Is it clear, or is it still confusing? I know it's a lot of information, but I keep going back, so because I want you guys to understand